Well, for the first time, we have a clear picture of the hole in our health workforce, and it's huge. We're short nearly 5,000 nurses, 1,050 midwives, 1,700 doctors, 220 dentists and 200 anaesthetists. All up, that's around 8,000 health workers, a figure the Health Minister herself admits is confronting. But it could get even worse as the population ages and demands on the health system increase. That gap could blow out to 24,000 by 2030 if nothing changes. So the government has come up with a plan to train and recruit the health workforce we so desperately need. Political reporter Amelia Wade explains.
The Health Minister was once a doctor. It shows.
Just like in medicine, you can't start the treatment until you've got the diagnosis right.
The health system is her patient now. It's just had a checkup and the prognosis isn't good.
What's your diagnosis of the health system at the moment?
Need more growth.
She made that diagnosis after Te Whatu Ora examined its health workforce for the first time. Turns out the size of the health workforce has actually been growing steadily. This graph shows the increasing number of nurses. Since 2017, it's jumped by almost a quarter. But
it's not enough to keep up with the population, the ageing population and the new demands we need, so we have to do more.
There's essentially three ways to do that. You train him, import him and keep him.
This is the first time that we can see in the New Zealand health system that we've told New Zealanders what the gap is.
Te Whatu Ora is also able to tell universities what that gap is so they can target student recruitment. And the students themselves will earn while they learn, getting paid for their placements.
I think the proof will be in the pudding. That is, once this plan is put into place, it'll be very, very important that the benchmarks that they were wanting to achieve are achieved.
It's also going to take the sugar hit of immigration to recruit specialists. A hub is being set up in London to directly recruit from the UK, though the Nats have their doubts.
Health New Zealand being an offshore recruiting arm fills me with dread because their ability to be a recruitment agency to date has been absolutely appalling.
And then the plan is to keep workers by treating them right, like ensuring access to food on night shifts and more support.
Now, for some people, that makes the difference between staying in the health sector or driving burnout and leaving.
A lot of midwives have already left their jobs, but the sector says this workforce plan doesn't address that. The acute shortage can't be filled quickly because it takes 4 years to train, and it's hard to import midwives, so it needs to bring back the ones who've left.
We've had a lot of discussion, about the health workforce issues, but we haven't had an opportunity to really have any tangible input like this.
The plan's been launched today, and certainly we'll be engaging with the groups, midwives and things, to make sure that we incorporate and deliver on the initiatives that we've outlined.